Thousands of families are currently waiting for a life-saving transplant. Thousands more wait for tissue, bone, skin, and corneas. One donor can save or improve the lives of more than 50 people. Donated organs are used to save a life of people with organ failure. Donated corneas restore vision to the blind. Donated skin, bone, and tissue help repair defect, promote faster healing, save limbs, and can save lives of those with severe burns. Heart valves give patients a chance to resume normal life. Americans received more than 28,000 solid organ transplants and 1 million tissue transplants annually. Unfortunately, thousands die every year waiting for a donor organ that never comes. You have the power to change that. Good evening. It's my pleasure to welcome Dr. Jorge Ortiz, Assistant Professor at the University of Toledo, specialized in organ transplant. And it's a new subject, hot subject, and it's really, we want to shed the light and educate the general public about this important subject in our life. Thank you for being here, Jorge.
Thank you for having me.
Thank you. Do you mind to tell us some ideas about organ transplant, how important that subject at this point in this nation?
Well, there are about 100,000 people on the kidney transplant waiting list, and about 8 to 10% of them die every year waiting for a kidney. There are about 15 to 20,000 people on the liver transplant waiting list, and many of them die. On the pancreas transplant waiting list, which is what we do for type 1 diabetes, about 5,000 people, and they have a very high rate of death, about 10 to 15% a year. Right? So basically, about every 3 hours, somebody dies on the waiting list waiting for an organ. Right? So we have made great advances in terms of scientific technology, surgical techniques, medications, but we need to make more advances in terms of organ donation. Absolutely. And education.
Where is the problem in organ donation?
I think there is just a lack of education amongst the lay people. There are many established reasons why donor families tend not to donate. A lot of them are suspicion of the healthcare system, fear that the donor won't be treated with respect, fear that we're given up too early on the donor. So many, unfortunately, many myths out there, and that people don't understand the concept of brain death as well. It's very important to note that there are no established religions that contradict organ donation. Every established religion in the world is in favor of organ donation.
Okay. And there is some also the organ donation from live subject, I mean like the kidney.
Correct. So it's very interesting. There are about 5,000 to 7,000 live donor procurements occurring every year for kidney transplantation because we have 2 kidneys. You can donate 1 with next to no problems and long-term problems. A liver can be divided and then donated from a healthy live donor, and then the liver is like a starfish. It would grow back. So it would grow back in the donor and the recipient. There have been pancreas transplant, partial pancreas donation for somebody who needs a pancreas transplant. The small intestine has been donated. 1 lung has been donated. So many things can be done in that live donor sphere, and a lot of times it had to be done because there are not enough deceased donors. Absolutely. So in a perfect world, we'd have more deceased donors, and we'd still have a healthy number of live donors, and we'd minimize the death rate while waiting.
37-year-old Army veteran Chris Wagner didn't realize the fight of his life would occur off the battlefield.
Your whole body starts to crash, and then it becomes very dangerous.
Chris was fighting a chronic disease called primary sclerosing cholangitis, and it was slowly destroying his liver.
The only cure, or the only actually way he will live to be an old man, is going to be liver transplantation.
Doctors told Chris his best chance was to find someone willing to donate part of their liver.
It's a humbling experience when you start looking for a live donor and people actually start to volunteer, because it is a dangerous procedure for them.
That's when Molly, Chris's sister-in-law, stepped up.
Looking at a life without him, and it just wasn't a possibility, so something had to be done.
After several rounds of testing, Molly and Chris learned they had a match. Doctors at Cleveland Clinic took about 60% of Molly's liver and gave it to Chris.
If you split the liver into 2 pieces, both livers can regenerate like a normal size.
During the operation, surgeons used a special 3D liver model, an exact replica of Molly's liver, that allows them to see inside the organ before a single cut is made.
We can see all the relationship of blood vessels and bile ducts within a segment of the liver to determine optimal way of doing the surgery.
All went well, and Chris's condition improved hours later.
That was something everyone was thought was pretty remarkable, how much better you look immediately.
Seeing him healthy, and it was just a relief to be able to not worry about anymore.
Happy New Year. It's that time again when we set new health goals. For some health tips, go to ToledoCardiology.com, because remember, time waits for no one. Right, with the difficulty of having those organ donors, if there's any option or future option, open the horizon for all of the people and give them hope about some other potential treatment.
There are some exciting technologies, perhaps cloning, where you can take a cell, put it in a dish, mix it with a hybridoma, and then grow out the organ, and then transplant it back. Probably right now, the one that's most likely for that would be the heart, right? Since the heart is mostly just a pump, right? It's just a pump, and perhaps either you can clone an entire heart, right? Or clone cells and inject them back into a failing heart, and then have the heart rebound. That would be one exciting endeavor. The other organs, the kidney, although they've built a kidney with using a scaffolding 3D technology, it has more functions than a heart than just the muscle of pumping. And the liver is the most complex organ in the body, so that would be hard, but potentially you can do that. Additionally, you can have xenotransplantation, which has been tried a long time ago. There was baby Faye from Loma Linda who received a baboon heart, and then there have been people who received pig livers in the past, and pig livers for long-term outcome would be difficult as of right now. We'll get into that, but pig livers have been used for short-term outcomes in terms of when people are struggling with their livers. They use the pig liver in order to clean out their system while their own liver bounces back. Right? Okay. There are some issues with the xenotransplantation in that there's immune barriers that we have not been able to overcome yet. Okay. So we would probably have to create a syngeneic pig model, a model that has the same genes as a human being, so they wouldn't have these rejection issues, right? And then the big fear is something called PERV, and it's PERV, stands for prehistoric endoscopic retrovirus. The fear is that there's some kind of virus on a pig that's been hidden in their genome, but then once you expose that into a human, that might be something that's terrifying. Absolutely. Right? Absolutely. But it's an exciting endeavor, and that's probably something that we'll be talking about more realistically in 10 or 15 years.
10 to 15 years. So in reality, when we are talking to the patients about organ transplant and about the potential treatment, and they are not able to get that organ, I mean, are these options discussed with them at this point, or
unfortunately,
it's not available yet?
It's not available yet long term. Unfortunately, we are confined to split liver transplantation using live donation aggressively and appropriately, and deceased donation, and that's the most important low-lying fruit that we can get with more education of the lay public.
But we hope for the future that's going to be much better based on what you just suggested, I mean, from the technology.
The pig is an underestimated animal. Known better for its slovenly habits and portly physique, the pig is actually a medical hero.
Pigs have tremendous research potential, and a lot of different diseases are being studied through pigs.
Pigs are more like us than you might think. Their physiology, their biochemistry, their cell biology is similar to ours.
It's best to study something like heart disease in an animal that has developed heart disease, and that happens in pigs.
If you derive neural progenitors from stem cells,
a team of researchers at the University of Georgia, led by Dr. Franklin West and Dr. Steve Stice, have discovered a way to create pig stem cells.
It's really a very magical process.
Stem cells are genetic building blocks. Tell them to become a kidney or an eyebrow or an ankle bone, and they do. By experimenting with stem cells in pigs, we can learn how to make them work in humans.
Eventually, someday, we may be able to transplant whole organs from pigs into humans.
These researchers expect to change the genetics of pig stem cells and eventually human stem cells and eliminate organ and tissue rejection.
We can then make a cell, hopefully, that won't be rejected by the human immune system and therefore would last a long period of time.
This technology could be used to save endangered species, like the dying lions of the Serengeti.
You could actually collect cells from some of these deceased lions and turn them into stem cells and use them for cloning or other applications and actually reintroduce the genetics back in the population.
It is likely that young people today suffering from type 1 diabetes will benefit from this research well within their lifetime.
Happy New Year. Take one step at a time and you can reach any health goal. For health tips, go to ToledoCardiology.com because remember, time waits for no one. Now, I understand that you are an expert in organ transplant, specifically abdominal organs, and you've been doing this for a long time. And now in University of Toledo, can you give us an idea about the program? What could be done at this point? What's the future projection?
So the kidney transplant program is very healthy and robust. What's very interesting in our program, and my partner Dr. Reese is one of the nation's trendsetter on paired donor nation. Mm-hmm. So what happens is if there's a live donor and a potential recipient and they don't match for certain reasons, for complex immunological reasons or not blood type reasons, mm-hmm. Dr. Reese has a complex algorithm put on a computer. He puts many of these candidates into a computer, and then he can find all across the country potentially another donor who is compatible with that recipient who has themselves a donor that does not match. So this has been done in Korea many times, in Japan, in places with low deceased donor donation rates, and now it's being done here with more and more frequency. So Dr. Reese and the University of Toledo has worked with other centers to have as many as 6, 8, 10 donor-recipient pairs, mm-hmm. all working in concert across the country to start a cascade of organ donation and then transplantation.
That's impressive.
Yeah, and then at the UT we're trying to start a liver and a pancreas program. Mm-hmm. I should say restart it because they had it a few years ago. So restart it, and hopefully that will help this Northwest Ohio area. Because as of right now, those patients in need of pancreas transplantation and liver transplantation and heart and lung have to leave the area. Mm-hmm. There's probably about 1 million people who have to leave the area to go to other surrounding centers.
Absolutely. And the kidney transplant program, which is we have at this point in UT, what is the requirement? I mean, how is the program run? I mean, do they send the patient to you from different hospital, different institution? Yes, how can we make it more efficient and more productive?
So we receive referrals from all over the region, from Michigan, from Ohio State region, Cincinnati, Columbus, some as far as Indiana. We've transplanted recently somebody from Chicago. I've seen 2 patients who are from my neck of the woods in New York, mm-hmm. right, who've come to see us because we have a healthy reputation with good outcomes, sure. and this paired donor exchange as well. So we are pretty in tune with intense care and then also intense communication mm-hmm. With their doctors even when they go back, because we like to see them for the rest of their lives,
sure.
right? So, but after a while, after 6, 7, 8, 10 years, we still see them. But it was very important that we relay information between us and the primary gatekeepers.
That's unbelievable. Do you mind to give us some idea about the numbers lately? I mean, in the last 2015, how many?
A number of transplants done a year, it's about 80. We've been doing about 80 a year, probably about 65 deceased donors, mm-hmm. and about 15 live donors every year, mm-hmm. right? So we are with good outcomes, and we are trying to balance good outcomes and appropriate aggression, sure. so we don't have people, passing away on the list, mm-hmm. waiting for a transplant. That's the ultimate crime, absolutely. Right? And also trying to minimize loss of potential organs, for procurement and eventual transplantation. We're trying to maximize that scarce resource.
The big question which I always been asked by some patients who has end-stage renal disease, is every patient with end-stage renal disease a candidate for transplant?
The idea should be broached, at least thought about. We have standard contraindications. Mm-hmm. So somebody who is an active drug abuser, mm-hmm. who has active infectious issues, mm-hmm. who has unfixable cardiac issues, perhaps not necessarily extremes of chronological age, but extremes of physiological age, frailty. Those would be cancers that are not treated. So those would be the standard contraindications for kidney transplantation, as well as organ transplantation generally. But if a person was a drug abuser, but now they are no longer, if they had cancer, but now it's resolved, if their social issues are now remediated, if they've lost a tremendous amount of weight, if their frailty is improved through exercise, we will consider them.
Absolutely. And that brings me to the point, which is all of the patients in general should seek that help and should require some further investigation probably, and your center can come up with the best conclusion at the end that you are the best candidate or not.
Correct, and it is one of the rules or guidelines from the nephrologic societies that every month the concept of transplantation needs to be discussed with the patient.
Wow.
Right? So they need to discuss it and then say, okay, this person is not a candidate for this reason, or perhaps discover that the reasons for contraindication before no longer apply, and maybe they should move forward and get a transplant evaluation.
That's interesting. And when we compare our center based on what you're just telling me, 80 cases, that's a good number so far. I mean, for restarting the program. Right. I mean, comparing to the other big centers like Cleveland Clinic or Ann Arbor or Ohio State, I mean, where we stand?
They probably do a number more, 140, 150 a year probably.
Bigger geographic
Bigger
area.
geographic area, but in those places they have also have a much higher wait time.
I see.
Right? Higher death rate, therefore waiting, and probably a little bit more costly care that they give. We pride ourselves on very individualized care and high level disposition of our skill set.
Sure.
Right? So although our numbers are smaller, we have good outcomes, and we think definitely low wait times.
Absolutely.
And the lower the wait time, the earlier the transplant, the longer the patient lives.
Absolutely. And I know to have a successful program like that, it's a teamwork. It's not only a nephrologist and a surgeon. Definitely you need the immunologist, you need the lab, you need all of those members are available and providing all of the services
Correct.
in UT.
Transplant's at the forefront of many of the innovations that are happening now in healthcare. These are accountable care organizations in terms of length of stay, utilization of resources properly, also communication. So we have nephrologists, surgeons, transplant coordinators, financial coordinators, social workers, immunologists, people in the OR. We have multiple meetings in trying to improve our communication or maintain our high level of communication, because we know that is associated with good outcomes.
Absolutely.
So we're at the forefront of that in terms of healthcare changes that are happening in the United States.
And you said that you like to see the patient for long term. I mean, does that mean they will have the follow-up with your center on regular basis, or they will go back to their doctors who've been taking care of them before?
Both, right? We try not to steal the patient,
Sure.
quote unquote, because we understand the importance of that relationship, but we do want to see them. So it's unlike an appendectomy where you see the person once afterwards.
Sure.
We would see these people forever because they have lifelong risks associated with the transplant and the immunosuppression.
And for that immune suppression, technically they require a lot of testing and biopsies, and that's why, I mean, it needs more expertise, professional people who take care of that part. It's not only just going and checking the blood pressure and checking the blood test. I mean, it's much more than that.
And many of these problems are subtle. They need to be picked up by experts. Also, many of them are asymptomatic.
Okay.
So the person can be feeling totally fine, and then we do a blood test and the creatinine is elevated, or the liver function tests are elevated, or something like that. So they need to be seen by experts.
Absolutely. Now, leaving the kidney transplant, and we are talking about the pancreas and liver, and I think University of Toledo is trying to get all of the aspects of the program ready, hopefully, to have it done very soon. Are we talking about closer day?
Hopefully, the pancreas transplant is frequently done with kidney transplantation. So that's a kind of a natural just growth of
Sure.
one, and that would not rely on tremendous outlay or anything. So that's the logical next step, hopefully within the next year to 18 months. And then after that, maybe 18 to 24 months would be the liver transplant program afterwards.
That's great. And I hope we'll get the heart transplant again, right?
Correct.
That's great. What's your recommendation and suggestion, advice to the people about organ transplant? I mean, about donation.
Discuss it with your loved ones, right? Recently, about a month ago, we had a donor who had signed the card and stated he wanted to be a donor, and he had some kind of accident, and the family contravened it, and he never donated, right? So that's 7 people whose lives would have been saved, and 15 other people whose lives would have been improved by the act of donation. So we just ask that you discuss it with your loved ones and make sure that everybody knows your wishes, and that so you can hopefully help as many people as possible.
So what would you tell the family of a potential donor when they are deceased or they have a brain death, and you know, you wish that those people are going to agree for the organ donation? How can you convince them?
So it must be acknowledged as a very difficult time. So they had some kind of tragedy that's happened to their loved one, so
Absolutely.
It's very important that they be approached by the experts in the field properly. If I had the opportunity to speak to them, I would tell them that, as mentioned before, all religions in the world all accept donation and profess that it's important. I would also state that there are many rules set in place to make sure that the deceased donor is treated with respect and treated completely, right? And to make sure that there's no chance of survival, and that when the person is actually brain dead, they cannot bounce back from that.
Absolutely.
And then, so that would be on that respect side for the deceased donor. But it's very important to note that for society's sake, 7 to 15 people will be have their lives saved or improved by that act of donation, a truly charitable act of donation.
Unbelievable.
And it would be, therefore it's very important to have discussed that in the past and to respect that donor's wishes.
Absolutely. And really, I heard it from few people who the family agreed for organ donation for their deceased loved one. They always tell you that we still see our father or mother or brother or sister, whoever really that deceased loved one. I mean, they see it in those individuals by saving those 17 life or 10 life. I mean, and that's no question about it. It's honorable.
In transplantation, we call that making sense of a tragedy.
Absolutely.
Right. So making the best of a horrible circumstance.
Absolutely.
But that's sometimes in life that's what we're left with. Right, and to follow one tragedy with the other tragedy of not donating does not make sense. So in this case, at least you can make some sense of a terrible happenstance.
She was a pretty vibrant character. She had done so much in her life, more than an 80-year-old person.
Stacy's mom, Kathy, says her daughter had a good heart. She was always thinking of others.
She lived life and she cared for people.
That was obvious even when Stacy died on September 15, 2010, after she was struck by a car while riding her bike. She told her sister years before that she wanted to be an organ donor.
Why would I just want to be buried 6 feet down and not, continue life if I had the opportunity to?
And today, her mother got to meet 3 of the 5 people Stacy was able to save.
So nice to meet you.
Sherry Halstead received a pancreas and kidney. The doctors told her she wouldn't survive long without a transplant.
I got diabetes when I was about 30.
Leslie Campagnone is the public affairs manager for the Washington Regional Transplant Community. She says these types of encounters are rare because oftentimes the recipients feel guilty or families decide they don't want to meet. But she says it highlights how big of an impact one decision can make.
Every day, 21 people die waiting. The organ never came.
But because of Stacy, 5 people didn't have to die.
I was wondering exactly where it was.
And for Kathy, it was a decision that has given her peace.
This is so special.
So if I want to ask the question, as an expert, someone does the surgery, does the transplant, what drew you to the transplant aspect of this procedures? And
well, I'm trained in general surgery, and to me, transplantation takes the best aspects of general surgery: vascular, oncologic, urologic, hepatologic. So I enjoy that stuff in terms of technical and medical challenges. What keeps me involved and happy is the relationship with the patients. When I was a fellow, back in the old days, the old bad days where people were sick and everything, and I got maybe depressed or wondered about this field, and then one day I went to a Christmas party. And all those people whom I'd forgotten about, who went home in 7 days, who had great outcomes, and all those people, they all came back when hugging and kissing and remembering the date of their transplant as if there was they called it a new birthday. So that kind of feeling that we have in transplant is very enriching for me. Right, unlike somebody who had an appendectomy or, no, I had that in the 80s sometimes. Yes, and when did you have your liver transplant? December 12th, 1994. my surgeon's name was blank, all that stuff. So that's very, very enriching for me, as I said, and allows us to work hard, because sometimes, we have to work in the middle of the night. It can be frustrating and all that stuff. But that kind of behavior from the patients, that gratitude, is what drives us.
I think it is rebirth for these people, because
exactly.
really you are saving their life by doing this kind of procedure, which is a complicated procedure, but in reality, a life-saving procedure for them. And I think that's tremendously, we recommend for everybody to discuss it again and start thinking about these transplants, about organ donation, because it's so important. And that's really our goal in this program, is to talk about organ donation, motivate the people to donate their organ, because it's so important. And they will help a lot of people.
Every transplant discussion must begin and end with organ donation and the need for more organ donors.
Absolutely. We really appreciate your input and your expertise. That's
Thank you
really
very much.
tremendously helpful to have, and we are proud to have it back in our community in Northwest Ohio, and we hope to see the program growing to a much higher level and much better level, and thank you so much.
Great, thank you very much.
It's my hope that tonight's program will help to guide you and clear up any myth or misunderstanding about organ and tissue donation. We now understand which organs and tissue can be donated and how donation helps save and enhance life. We found that nearly all religious groups support organ and tissue donation and transplantation, as long as it does not impede the life or hasten the death of donors. There is no cost to be an organ and tissue donor to you or your family. Medical and nursing care is not affected in any way by your status as a donor. Every attempt is made to save your life. Signing a donor card and discussing your decision with your family members is the best way to ensure that your personal wishes will be carried out. Factors such as race, gender, age, income, or celebrity status are never considered when determining who receives an organ. The donor's body is treated with respect and dignity throughout the donation process. Donation does not disfigure the body or delay the funeral. No one can sell or buy your organ. In fact, it's illegal in the United States to buy or sell human organs or tissue. Organ donation does not happen until after brain death occurs. You can make a meaningful difference in the lives of others by joining the donors list. Thousands of people are searching for hope. They are waiting for you. Save more lives by telling your family you want to become an organ and tissue donors, because remember, time waits for no one.